Okay, so what is the topic then? Is our topic COVID-19, being deaf and wearing a mask? Is that our topic?
Yeah, basically. So, when did you notice the masses? Or when did you notice that it was gonna be different? Because when COVID hit, I didn't even think of anything of it. I was like, oh, it's just another sickness, like H1N1 that
Yeah.
came and gone, and then all of a sudden they're like, oh, masks are mandatory because COVID is airborne, so now we have to wear masks. And I was like, oh, perfect. That means I'm not going to be able to communicate with people.
Yeah, well, you know what? Where I live, it was never mandatory to wear them. But in my work, it became mandatory, right? So so my first experience with it wasn't wasn't really good. I mean, I was working with a senior that developed a fever, not quite high enough to be we're getting tested for COVID, but it was a fever, right? And so anyone working with this senior had to wear a full PPE gown and like a mask and gloves, and we could not enter their facility, their building, nothing unless we were fully in gowns, right? And so the first time putting on this whole outfit was funny, right? Let's take, you want me to take a photo of you? Yeah, take a photo of me. Make it funny. It was fun until it came time to do serious work with whoever you were working with, right? And for me, the first time that I put it on, it was with a guy who is from China, and great guy, so funny, nice, sweet, soft spoken, right? And so you add soft spoken with an accent and a face mask and being deaf, trying to communicate serious work was very hard, right? And I found myself trying to guess what he was saying and just nodding and going, uh-huh, oh yeah, yeah, right? And I could see in his eyes that he was like, what? Right? Like,
Oh, always just guessing.
I was put on the spot and I could not say, for the life of me, I could not say, I can't hear you, I'm deaf. I could not, it just could not come out of my mouth because I had been working with them for so long and I never needed to say those words. I'm sure they have figured it out, but I would never in the position to have to say those words, right? And I could not, you could not have paid me any amount of money to say those words without me quitting on the spot and leaving, right? I just could not have said those words, right? And that day, that shift was like a wake-up call of what to expect at this job, right? And from that senior getting a fever, everyone had to wear these masks and gloves and these gowns at all the facilities, seeing any patient, client across, like there was no getting out of it, right? Now, luckily at that job, because I have two jobs, luckily at that job, most of the work is independent, right? It's me and the client, right? And the client never really wears the mask, right? But so I was able to manage okay because of that. But when it came time to have partners or work with people helping a client, impossible. It was so difficult. And then I had to go on Amazon and I bought a small hearing device for like $80 because first of all, I can't afford hearing aids and my insurance doesn't cover more than $100, $200, which
800 per hearing aid or something.
yeah, to go buy something, anything that might potentially help me to be able to navigate it. So that was my first experience with mask. What about you?
Well, I started wearing masks pretty much at the start of COVID. It was like, once I found out it was airborne, I knew, like, I need to wear a mask. When you put mask and hearing together, for me, I automatically knew that that means I'm not going to be able to communicate. Like, at the time, I was not working. We were going to school, so I was at home most of the time. So the only time I needed to wear a mask was to go to the grocery store or any public place. How did the hearing device help for you? Like,
Amazing. It's not fixing all the problems, and it doesn't make every conversation perfect and I can hear every single word, but it took me from not being able to hear someone at all or communicate with them to hearing what they could say and communicating with them and getting jobs done safely for me and for clients, right? So it went from like 0 to at least, I want to say 7 or 8, right? So for me, it's now something I depend on, right? And if one time I left it at home and I completely turned around to go get it, damned if I was late. I did not care. And in fact, I even made a illegal turn to go get it because there was no way I was about to go to work without it, right? So it is now something, and I never thought it would be something I would depend on, right? Because I've always been stubborn when it came to wearing hearing aids and devices and things to help me since I was a child, right? And the history of me not wearing them it's different, and it's not something that necessarily pertains to this. And it's not necessarily a good thing. It's not a good thing that I've always been like, no, I refuse to wear them, right? So it's interesting for me to see, and you can see it too because you grew up with me where I would not wear them, right? Have you ever really seen me wear them?
no.
Right? Never, right? And so to see someone who would never wear it to now suddenly I'm saying I won't leave my house without it, like mind blowing how different.
Honestly so surprised when you told me you were buying some hearing
Yeah,
device off Amazon. I was like, oh,
yeah.
that's serious.
And to bring that up, you were a little bit critical of me buying something off of Amazon.
I was. What did I say again?
I I I, I wouldn't be able to scroll and find it because we talk too much. But it was like at first it was like, oh, okay, good for you, blah blah blah. And then a few hours later you sent me some messages saying basically, so like, do you think so you don't need real hearing aids, you don't need to go to an audiologist, you don't need that, do you think it's gonna completely fix it? I should really go find it because it was a paragraph of you criticizing, not necessarily criticizing as your main tone, but what you said was very critical. And I had to say,
No,
no, I don't think it's going to replace specialist or audiologist or any of that. I just need something right now to help me. And you're like, oh, okay.
or concerned with like how would it help you? Because like for my hearing aids, I have to go to the audiologist so they can like adjust the volume on them.
Yeah.
Like,
Yeah.
that's what I was trying to say.
But you were very critical about it. And so I immediately sensed it and I was like, no, 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 I'm not trying to replace the specialist and the professionals. And no, I don't think this is the proper type of hearing aid. And no, none of that. But I just need something right now because I'm struggling and it's not working. And what I did before is not working. And I'm unable to do my job now because it's not working. So I just need something, anything, and it's cheap and I can get it quick. And you were like, oh, okay. And then later on, you became more supportive of it and happy that I found something that was working for me in the moment.
Yeah.
But
I was just concerned, like, would it work for you? I don't know.
yeah. Yeah. But I remember that.
Sorry about that.
That's okay.
I was not trying to be not supportive. Like, I've always like,
But I could,
really needs.
yeah. But I could see your concern through it. So that's why I made sure to clear it up, because I didn't want you to read into anything I said incorrectly, because sometimes I don't say things clearly. I just say it because I'm busy and I'm working, and I don't take the time to clearly state it. And I could see that you were reading into it too much. And I was like, no, 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 no. Let me clear that up. I don't want you to read into it.
Well, just
Just
take
not,
into everything.
me too. It's okay. But yeah, you do that a lot, hey?
Yeah.
But I did write something down that I don't think it clicked for me as fast as it did for you with being deaf and wearing a face mask and having struggles. For me, it was more concerning about my jobs. Was I going to be able to work? The city is closing down. That was my first initial impression of COVID. It wasn't necessarily immediately, I'm not going to be able to hear or communicate. So it's interesting that we have two very different impressions right off the gate of it. But you quickly quit working though, right? Because of COVID and the face mask.
I stopped working like long before people started wearing masks. Sometimes I wonder, like, had I kept working, would it been such a big deal? But I think I probably would have experienced like what you experienced at work. It's like once everyone was masked aside, it's like communication's out the window.
Yeah.
Everyone needs to communicate with me.
Yeah. I mean, it's hard enough to communicate without them, let alone. And I don't think maybe people don't necessarily even think that that is our first go-to way to hear someone is reading lips, right? It's my number one way. I don't even notice when I do it, right? It's just, and I find myself doing it even though someone's wearing a mask, that I still try to look to where their lips are, right? And
Did you know that you read lips before the mask started?
yeah, oh, absolutely, right? And it's weird. Like I could be talking with someone, and what was I gonna say? I completely forget what I was gonna say. That's what I was gonna say. That I could be talking with someone, and they could be loud enough that I could hear them, right? But it was almost as if they were drinking coffee and covered their mouth. I suddenly couldn't hear them because I couldn't see their lips, although they were loud enough that I could hear them and understand what they were saying. But I always noticed that the moment that their lips were covered for a second, it was like, what, can't hear you, right? Even though I did hear them and I could tell you what they said, but the moment that their lips were covered, it was like, huh, what? Right. So I've always noticed that about myself. And I think people noticed it too. I think people noticed that I was always looking at their lips, but they never really said anything. Right. But it was my number one tool to hear people and to communicate with people.
Well, for me, like, I just graduated from school, right? And so I was hoping to work in like group homes, working with people with developmental disabilities, which means that they have, a high risk to being exposed to COVID, which means you need to wear masks as well. You're working in a group home. So then that means that I might not be able to work at a group home for as long as these masks are around. So now I'm just basically working respite childcare jobs because you don't really have to wear masks as much.
Yeah.
You're just working like at their house and you have a small social circle, which is what I'm doing with the family I'm working with right now. Like they don't go anywhere.
Yeah.
They're really careful. They made me wear a mask at my first child while I was there, but they didn't wear a mask because, like, I told them I would breed, I wouldn't be able to hear, so.
And plus, it's their home, and you're going to be working in their home.
Right, so I was like, I would accept you.
for them. Yes. And so that's interesting because I technically work for a group home, right? And for the first while, it was very strict. Like you could not enter the building or the house without changing your outfit, sanitizing, putting on a mask, hand washing. And then immediately washing whatever you weren't wearing as soon as you got in, right? And wearing a mask for 12 hours a day, right? They didn't have to wear a mask because it's their home, right? But I had to. But I'm lucky that they figured it out to where it was very little people coming and going. So I never saw my coworkers. We did trade-offs where I would leave this area, they would come in this area. So I never saw coworkers. So I never really had to worry about working with coworkers wearing a mask, right? And so that was helpful, but I was wearing a mask for a long time. And if we left the house, we were all wearing masks. And I work with people that have intellectual disabilities, right? So the speech isn't always the best, right? And I have a hard time understanding them all the time, right? And to put a mask on top of that, right? It was definitely a learning curve for me. It was not easy at all, right? So luckily I bought that hearing device on Amazon. That really helped because I don't know if I would be able to work my jobs without it. I really don't think I could.
But do you still wear it, like, even if there's no masks on, or?
Yeah, I'm wearing it right now.
Oh,
Yeah,
wow.
yes, I am.
Yes.
I know, because I'm sure you've noticed, but where, yes, I could not wear it right now and hear you fine and talk with you, I wouldn't be able to hear as much, right? And so wearing it right now, I could put my computer over there, or I could go to the bathroom and I could still mostly hear you, right? Where before, if I couldn't see you, if I turned away or if you turned away, I wouldn't be able to hear you, right? So yeah, I put it on today so I could be able to have a really good conversation with you and be able to hear everything nicely, right? And so yeah, I do wear it now almost the whole day, whether or not people are wearing a mask or not, right? And
That's
even to go to the grocery store now, where a lot of people don't wear them, but I wear it a lot.
COVID did. Like, imagine if COVID didn't happen, you wouldn't have bought it. Or would
Yeah,
you?
COVID made me grow a lot in ways that I really don't think ever would have happened.
Yeah, like, same with me. Like, before, I never really told people on the spot that I am hard of hearing or deaf. Like, it would not come out of my mouth. Like, I
No,
would
I would.
what? I can't hear you. I don't know.
Yep, same. I would have quit my job. I would have never gone back to that store before I had ever said those words. I'm deaf.
But
Never
it's so
happened.
hard now. Like, it's.
It is. And it depends on the situation and where I'm at, how easily I can say it. But a few days ago, I was at the pharmacy and the guy was wearing a mask, and I immediately told him, I'm deaf, I can't hear you. And I didn't ask him to take his mask off, but he immediately took off his mask, right? And luckily, he was a nice guy, because I've had rude people when I've said it, and I've had people, and that's another thing, another topic for this, is how people treat you, right? So luckily in that moment, that guy was very nice and respectful. I didn't ask him to take the mask off. I don't necessarily want him to take the mask off, but at least he
Like,
was
that's the
nice.
first thing he thought of, like, when she said that.
Yeah, and which is fine, like, but I'm just happy he was nice and was willing to do whatever to communicate with me better, right? Which I've had people not do that and not write things down and not do anything but just proceed to yell and yell and yell and yell what they want me to answer, right? So for one time I was trying to get into a facility to work, and this lady was asking me a bunch of questions, have you had a fever? Do you have any of these symptoms? Blah, blah, blah. But I was like, I'm sorry, I can't hear you. I'm sorry, what? And she was just yelling and yelling the questions over and over and over again. Like how many times are you gonna yell, do you have a cough, before you realize I can't hear you and do something else, right? But in that moment, I could not say I was deaf. I'm sorry, I can't hear you, right? Because of how she was treating me. I was so uncomfortable. And it was a very frustrating moment. And I was not shy. I emailed all of our bosses about that. And I told them I expected change and to teach and train workers that there may be hard of hearing deaf people, right? Especially when you're working in a facility with seniors and people with disabilities, etc. How to properly speak to people and question people when they were coming in, and to get creative with how they communicate with people. But I can't do that everywhere I go. I can't email the grocery store when they have rude workers, right? So what about you? Have you had any rude people when you can't hear them?
Yeah, the doctor, when I went to the doctor the other day, well, like the secretary was really nice. Like when I told her I'm hard of hearing, I can't hear you, she took the mask off right away, no problem. But then when I saw the doctor, he sat down and started talking right away, and I didn't hear anything. I was like, I'm sorry, I can't hear you, I'm deaf. And then he continued talking, and I was like, can you just write it down or something? So I don't know what you're saying. And then he kept talking, and then I heard him say something like, you want me to write it down, or why did you come here and see me, or something. Like, he just sounded really rude. I could just see in his eyes that he kind of looked pissed off or something. I don't know. It was really, really uncomfortable. So I was just like,
I don't get that.
I know. So I was just like, okay. So I went in and told him what was going on, whatever. But after I told him my problems, whatever, he took the mask off and started talking to me. Like, he didn't pull it down all the way.
Oh, like it was only his nose? Or like, what do you mean?
It was like right here.
Okay.
The pedestal went up a little bit. So he was like, he kind of pulled it down and spoke to me, and he seemed really mad about it though. Like, he didn't want to take the mask off, and I didn't ask him to do it. I visually told him to write things down.
Yeah, because you don't really want them to take the mask off either. It's there to protect you, and but I don't like why he would say, why would you come here? As if I'm suddenly less worthy of medical attention because I'm deaf. Like, why would you? I would have gladly have emailed that doctor's office.
I didn't even know how to do it. I should have.
Oh, I would. Like, if I was treated that way. No, I don't like rude people, and I don't like being treated differently, right? And I have no problem calling someone out when they treat me differently, right? Oh, I would have loved to email them, right?
I could still email him.
You could. It's only been a few days, and I would. So, but how did they call you into the room? Did they wave you, point at you?
So the same secretary that I spoke to at the desk, she was the same person that, she pulled her mask off, and it was like, yeah, you can come.
Okay.
Yeah.
But why wouldn't they explain it to the doctor?
I don't know. I was thinking that she would like write it down on my profile and be like hard of hearing.
Yeah. Yeah, and on top of that, you told him you couldn't hear him because you were deaf, and he kept speaking as if he didn't understand what that word meant, right? Or he didn't care what that word meant.
Yeah, and then like after I told him to write it down and he pulled his mask off to talk to me, he started asking me questions like, oh, so are you hard of hearing, or like how long have you been hard of hearing, or whatever. Just like questions about it.
I woke up this morning and I couldn't hear.
I
Like,
should have said that. Oh no, I just woke up this morning, decided I want to be deaf.
deaf and got hearing aids. Like, first of all, it's none of your business how long I've been the way I am, if I was born this way or not, or if there was an accident or not, or genetics or not. That's none of your business. I'm not here for that. You are not my, I don't know what you call it, audiologist, hearing specialist, whatever. You are not that. I am in a walk-in clinic for something unrelated to that. So let's focus on that and let's do your job. And that's part of the reason why I've never wanted to wear hearing aids since I was a kid, because I've always noticed being treated differently, right? And
I know.
you were, yeah.
And then people that, I feel like we should leave this for another topic, but when people find out that you're like deaf or hard of hearing, they treat you differently.
As if you're less than, like instantly they find out, oh, and then you can almost feel the shift in how they treat you as if a completely different person. And I hate that, right? Sometimes you find respectful, kind people that could care less, but a lot of the time that's not the case. Okay, let's talk about the whole you don't look deaf thing, because I get that a lot.
I've never actually gotten that before.
Yeah, well, I get it a lot, and it may not always be words. They might not always say you don't look deaf, but the way they treat you, as if, like your doctor, for example, have you always been like this? Are you hard of hearing? Are you deaf? Right? And part of that might have been you don't look deaf, right? And you might have not had your hearing aids showing, right? And it's that whole mindset that people just can't understand, how you don't necessarily have these identifying things, so therefore you cannot be deaf. It's not possible. I don't see nothing. You don't have an implant on your head. You don't have these things. You can't be deaf. I think that's part of it, right? People are so worried about COVID and wearing a mask, being safe, and then they see someone who doesn't necessarily look deaf, whatever that means.
But what does this look like?
I don't know, but that's a different topic for another day. But you don't automatically look deaf, so they can't understand why you're not hearing them, right? Like, do you have a cough? Oh, I'm deaf, I can't hear you. Do you have a cough? Do you have a cough? Like,
okay, so like why?
They can't put two to two together, and I think a large part of that is you don't look deaf. And if someone doesn't look deaf, it's hard for them to be like, to instantly shift into a, how else can I communicate with someone, right? So it's something I get a lot because I don't wear hearing aids, right? So it's not like I can be like, oh, I'm deaf, I can't hear you, right? I can't do that, right? So I get a lot of, what? Can't? You're deaf? Huh? How does that work? You don't hear? How does that work? Right? So it's annoying.
Frustrating.
It is. And it shouldn't even matter if someone's telling you I can't hear you. It doesn't matter if they're deaf or not. It shouldn't even be a thing. It should be, well, how else can I communicate with you? Or let me be louder, let me do this. It shouldn't even be a matter of being deaf or not. It should not matter. And I should not have to declare that for it to matter, for you to do your job, right? Or for you to communicate differently. I shouldn't have to say that. It should not even be a thing, right? It should not be important, because it isn't. It is important, but it's not, you know?
No, like if you talk to someone and they don't answer, then you should like know, like, oh, like, okay, they probably don't hear me, so I should try this.
Yeah, it shouldn't even.
I've had times in the past, like pre-COVID, where people would talk to me from behind or in the bathroom. I don't know if I ever told you a story. This is like off topic, but like this person needed toilet paper in the bathroom, and I could not hear what she was saying. she kept like calling and calling it toilet paper, and I didn't know what was going on. Eventually she left and started talking to her husband and told him what happened. She was pissed off that I didn't get her toilet paper. And she called me some stupid French girl, French.
Oh, French. That's a little better.
But she thought I was French just because I didn't answer.
Yeah. That's fun. Off topic, I have had experiences in the bathroom where someone in the stall next to mine was talking, and I was like, are they talking to me? And I can't really hear them, but they kept asking, and I'm like, and then I would respond, and they were like, not talking to you. Right? So I have had experiences similar.
Oh my gosh. I can never hear what people are saying in the bathroom. I just
never.
So echoey, and I can't.
Yeah, I know, same. I've even had like friends like, oh, let's go to the bathroom together. Okay, let's go. I gotta go, whatever. And they're trying to like all talk while they're using the washroom, and I can't hear what they're saying. I can hear them talking, but I can't hear what they're saying. So I go, yeah, right? And I'm like thinking in my head, I'm like, I don't know what they're talking about. Right? Like, I hope they don't need something because I don't hear them. Okay, so what are some options? What are some solutions? What can we do? I'm gonna put it on you.
Maybe like go back and forth. It's like I wrote a list of things.
Did you? I didn't really write too much about it.
The number one thing is don't take off your mask. Like I never want people to take off.
Yeah. I mean, I've never asked anyone, excuse me, to.
There's some that for hard of hearing people who want people to take their mask off for them.
Yes. And I understand that. I get it. It's so much easier if they would just take it off. Like, just take the bloody thing off. It'll be faster. It's easier. We'll get out of here. Like, I get why some people would want that. I get that.
All other solutions are so, like, out of the way. Like, you have to...
Yeah, and it's not always easy to, like, oh, do you have paper? Do you have paper? I have paper. Do you have a pen? Okay, let me write this down. Relating to grab paper and write notes back and forth. It's not always the happiest thing to do, right? And people are looking and it's uncomfortable.
Yeah, like it's a pain in the butt to go get paper, pen, whatever, but it also like try to write down everything you want to say. But I think when you do that, you should just try to make it as simple as possible.
But it's hard though, because if you're at the doctor's office and you're there for a problem, you need to be able to say all these things that is going on and that you've noticed and that you're in pain and how it's painful. It's not always easy to be clear. But at the same time, I could verbalize what's going on and the doctor or the other person who can hear can write and I'll just respond verbally too.
Like, yeah, like if they write on paper, I always just like respond verbally because
I never thought about that. I've never thought about that because I've never done it. Because
I've never done like have someone write down stuff for me. Like sometimes people will write down stuff for me, like in the past, without me asking them to. And I'll respond verbally every time because they can understand what I'm saying. And also, like for the doctor's office, the speech to text app. I have this app called Otter on my phone. It is like really good. Like it automatically translates what the person is saying to text. So I always forget to use it while I'm out in public because I don't think of it on the spot. But I think it might work.
Yeah, it's an option. Yeah, I've never downloaded any of those apps or tried any of them, but it's an option if you need it. Which I think maybe I should try that.
Yeah, I want to try it.
Just to challenge ourselves and to see.
Yeah, I never think to use it, but also gesturing helps a lot.
What does?
Gesturing. point or
Oh, gesturing. Okay, sorry. Didn't hear
just,
you.
also learning basic sign language.
Yeah, which I agree, but it's hard to expect everybody to learn basic sign when even I don't know basic sign. Like they could know, like, and that's something I think about. Like, what if I say I'm deaf and they go, "Oh, whatever," and I'm like, "Yeah, I'm deaf, but I don't know sign." But I don't think it's realistic to expect or hope or want people
I don't
to
I
learn
don't think
sign.
everyone's gonna learn this. Deaf people go on hearing people to learn this forever, and
Yeah, but you know what? On the same token, though, maybe it is important that people in professional health fields and such should be required to know some sign.
some would be good.
Some is better than none, even if it's only one course of sign language in university.
Honestly, I think like one year of like one level of sign language would be perfect. Like
It's
I've
harder.
only taken one class which was like 1 year of sign language, and I practiced on and off for the last like 4 years, and I can understand when people sign to me, and I can kind of sign to people who are deaf, and they understand what I'm saying.
Yeah.
So
You were working at Tim Hortons. It's not that hard to learn, like small. Yeah. What is
boat.
what is that?
This is maybe chocolate,
Hot chocolate? Yeah. What was the other one?
but
What were you doing before I interrupted you? Tea? Oh, I do this.
this is boat.
But what?
It's boat.
Vote? That's not what I was taught. Okay. Or what's
Oh, iced coffee.
right? So like, simple things like that would be handy. Okay, what else? What else can we do?
Well, transparent masks are a hard thing to ask for. At the beginning, I really wanted that, but I feel like they've already making, all these, fabric masks or whatever.
Yeah. And it's probably more expensive to make, more time consuming to
There's a
make.
logging issue with the, clear. So, like, I don't know how it will work.
Yeah, yeah. What about those face ones, right? Where it's not right up against your lips, but it
The
yeah, the head ones with the plastic.
it's not the same as a mask, though.
No, it's not. But I see them a lot though. Yeah, I see them a lot.
I've seen them too, but it's still not protective. Cause like if they sneeze, that bad, I still go. But it may be a good idea, like if you're going somewhere to, like I want to get my driver's license, right? And I want to take, the course. So like if I go to class and masks are mandatory right now, how will I learn? So it might be a good idea to take clear mask for the instructor or like tell them ahead of time.
Yeah, or is it an option to like request it? Like, can you when you're or like
Like
before
just
you
have
register?
your mask ahead of time.
And I have to upgrade my CPR and first aid in like a year, right? So it'll be interesting to see.
Yeah, I can have to too. So I don't know how like that's gonna work.
Yeah, it's gonna be a little different. Luckily, I know all of it, right? And I do it.
I know stuff
Really.
already,
So hopefully it'll be a lot easier.
but I'll definitely like let them know ahead of time. Some deaf people have this microphone. They could have hearing aids.
Yeah. Yeah, that
But
you
they
can get.
have like how
Do you have one?
I have one. I never use it though, so I don't know. It might work. Basically, like how your hearing device works for you to hear
Yeah.
through the mask. So I thought it might work for me because like
Yeah.
just hearing aids is just I still can't hear through the mask. So
Yeah. Yeah, but it will be helpful. right? It's not going to make it perfect or completely do it, but if it can take your hearing from 2 to 4, that's good. Even if it's 2 to 3, that's better, right? Like anything you can do to help you in the moment is what you need.
Also, I don't know, some businesses might have switched over to remote to help us. I don't know, like banks and stuff.
What do you mean?
Like they might have, like you know how when instead of going to the bank, they might have online help where you phone call.
Yes.
Instead of that, like having email or online chat is better.
Yeah. Also, I had a phone call with my bank a couple weeks ago, and she had told me, and I didn't know it was an option, or I would have done it to begin with, but she told me for our next one, when we have it, the video chat is an option through the bank, right? So if you need to talk to your bank advisor about anything, that is an option. They have FaceTime.
Which bank are you with?
RBC. Right. I haven't done it yet, so I don't know how good it is. I don't know if it's on Zoom or if they have it on their secure website. I don't know, but she just said it was an option, and I was like, oh, that's good to know.
It depends like how clear the video is and
Yes.
how well you can hear them.
But I doubt it would be on Zoom because Zoom isn't very secure, right? So I'm sure it would be interesting. I don't know. I should maybe try it and see. Yeah, maybe call them about something that's not important and say, I need it to be on video chat and see how it works. Something that I wrote down for solutions was just to spread awareness, right? I think just talking about it and talking to your staff, right? So not just me saying, oh, there's deaf people, there's hard of hearing people, there's whatever you want to call us people, we're out here, we're in society. I think it's more important that bosses and employers take the time in their staff meeting, whether it's 5 minutes or just a reminder that there's people that are going to, not be able to hear you, and you're going to have to get creative, and you're going to have to speak loudly, you're going to have to do X, Y, and Z. I think that is really important, especially when in fields like healthcare and, stuff like that, where you're working with people and you're more likely to come into contact with deaf people. I think it's really important that clinics and health clinic, doctors' offices, hospitals, care facilities, whatever, I think it's really important that the bosses remind the staff, right? Like, hey, I know you're working a very stressful job and you're high risk because you're working with people. You're more likely to come in contact with COVID than the average person, but it's also really important that we're inclusive, we're including people, we're communicating with people. We're not getting frustrated or mean when we have to communicate with people, because that's your job, right? You got into this field to help people and to communicate with people and to fix people and whatever. It's your job, right? And I know it's more work, but I don't care. It's your job. You got into this field, suck it up. It's your job now, right? So I think it's important that people, and when I say people, I mean bosses, right? I mean employers and, CEOs. It's important that they talk to workers and remind them that there are people that are going to struggle more because of mask and COVID and whatever. I think that just spreading that awareness, especially in important buildings, is so important right now.
Yeah. Awareness is really important.
Yeah. And it's deeper than me wearing a shirt that says deaf, right? It needs to go deeper than that. It needs to come from your boss, because your boss pays you, right? And you need to be held accountable for it, right? So when you have someone coming to your clinic, you need to be held accountable for how you treat that person, right? And how you communicate with that person, right? It's not acceptable to be rude and to refuse to write things down. That's not acceptable. It doesn't have to be serious. It's just, hey guys, remember there are deaf people. So if someone's having a hard time hearing you, write it down. Just looking on the bright side, right? Is that what we were saying, right? Like for me, it's growth. Like I've grown so much because of this, right? And I can only imagine how much more society and the deaf community can grow because of this, right? So don't let the face mask and the struggles that we have now just like stop you where you are. Like let's get creative, let's have fun, let's grow.
It's definitely a great time to advocate for yourself, learn from it,
And
to be creative, be comfortable with yourself, because before this we were like not comfortable with.
I'm still not very comfortable with it.
Still not 100% comfortable with telling people.
I'm not comfortable with any of it yet, but I've grown a lot because of it. And also, if you know someone who is deaf or hard of hearing, I don't know the proper terms, to advocate for them, for your friends and your family, right? Like stand up, even if you don't know anyone that is part of this community, you can still advocate for people, right? And for inclusivity.
Yes.
Anything else?
No. I just don't be embarrassed of being deaf or not being able to hear, because like I grew up feeling stupid for not being able to hear people. So
yep. And be patient though.
Yeah, be patient. Be respectful towards each other. Yes.